Turning points change the course of our lives, whether it's a big decision, overcoming an obstacle or tragedy, or taking a leap of faith. These stories of inspiration and resilience are what Turning Point is all about. Hello everyone, and welcome to this week's episode of Turning Point. I'm your host, Priya Sam, and today I have the pleasure of speaking with award-winning physician, Dr. Alika Lafontaine. Dr. Lafontaine was born in Treaty 4 territory in southern Saskatchewan, and he has served in medical leadership positions for almost 2 decades. Now, last year, Dr. Lafontaine made history as the first Indigenous president-elect of the Canadian Medical Association. His biggest turning point came when he was studying to be a physician, and he was the only Indigenous student in his class. He almost dropped out, and we'll find out what changed his mind today. Welcome to Turning Point, Dr. Lafontaine.
Thanks for having me.
It's great to have you. I actually also grew up in Saskatchewan, so not far from you.
Yeah, no, that's fantastic. I mean, Saskatchewan was a nice place to grow up. As you probably remember, it's slow. You know, if there's one way that I can describe living in Saskatchewan, it's constant, right? Like you can depend on stability and things kind of staying the same. But I think just as I got older, I mean, one of the big exports of Saskatchewan is Albertans. So I ended up moving out west a little bit, but there are lots of good memories growing up in Regina and, you know, going to school in Saskatoon.
Yeah. And is a lot of your family still in Saskatchewan, or have a lot of them moved as well?
Yeah, I'm the middle child of 5 siblings. My parents still live in Regina. My brother actually lives right across the street, so it's kind of nice when we visit because we can see both of them all the time. And then my older brother lives there too, so still some family there. I have another brother in Calgary. But it's a nice little triangle. You can go down to Regina, and as you come back up to Grand Prairie, go through Calgary. So it's nice to go back and visit from time to time.
Yeah. Oh, that is nice. It's funny so I moved when I was 17, and then my family moved shortly after to Ontario. So I haven't been back there in so long. I think it's been almost 15 years. And I just, every time I talk to, like, I still have a couple friends there, and they're just like, you wouldn't recognize it. It's the city, especially Regina, has just changed so much.
Yeah, no, for sure.
So as I was doing some research for today's interview, I was reading an article that mentioned that you were homeschooled for part of your childhood. So tell me about how that happened.
Yeah, when I was in elementary school, like lots of young kids, I had some learning issues. Mine mainly focused on reading and difficulty pronouncing words, and the school system tried to intervene in the ways that they intervene, but eventually after, months of speech therapy and other things, they sat down with my parents and told them, I think this is a problem that's not going to go away. And as a result, I'm not really sure if your son's going to be going on to high school or university or all these other things. And, my parents were pretty heartbroken by all of that. But like many folks, they wanted to see me differently than the school system did. So homeschooling was a part of what they did in order to intervene, taking me into a different environment and, learning in different ways and getting attention from my parents to kind of push me through some of those challenges. For me, it ended up helping quite a bit. I have a son who has learning difficulties as well. And I'm kind of going through this now in real time, reflecting on what my parents went through. And I have to say, parents out there who are trying their best for their kids, lots of respect and, support from me. It's a tough thing to have a child who's going through learning issues, and those parents who do their best to try and help their kids succeed. I mean, it's something that you can't really measure in the moment that you're doing it. You don't really know how things are going to work out.
Yeah, no kidding. And I'm sure especially at that time when you would have been a kid, I think the resources that probably were available to your parents were very limited compared to what we have now.
Mm-hmm. Yeah, I homeschool my own kids, but it's not really homeschooling like how I was homeschooled. Like homeschooling when I was homeschooled was a real choose your own adventure. You found your own material. I remember my mom protesting in front of the school board building to try and get additional funding. So we could go out and purchase, educational materials and, consumables and other things. I think because of the work that my mom did and, other parents of that age, we're at a place right now where, online schooling is a thing and kids can learn in a lot of different ways. So just like things in medicine, like we do stand on the shoulders of the people who came before.
Yeah, wow. She sounds, just from that brief description, like a pretty amazing woman. Did she have anything to do with inspiring your interest in medicine?
My dad is Métis with Oji Cree ancestry. My mom's from the Pacific Islands. She was actually a first generation immigrant. I came over to California, and then it's a whole nother podcast how my dad convinced her to come up to Canada, especially Saskatchewan. But
No kidding.
Yeah, yeah. But she is quite an amazing person. I remember lots of conversations when we were younger. My parents talking about what we were going to do with our lives and kind of some of their aspirations for us. Higher education was always a big part of it. And I think my mom always had it in her mind that one of her kids would go into medicine. Because as a first generation immigrant, and my dad is somebody who grew up rural and who is Indigenous, I mean, there's a recognition that if you don't have people on the inside, it's sometimes difficult to get what you need out of the healthcare system. And that's just the reality, true for Saskatchewan and true for elsewhere in the country as well. We talk more openly about the reasons. Sometimes it's just poor access to care because people haven't built out infrastructure. Other times it's things that enter into, areas like racism and other things. And, being a physician and being able to have my parents pick up the phone and, call me in the middle of the night about an issue that they had and have me kind of talk their way through it. I think it's something that they really wish they would had when I was little, and that they're really happy that they have now that they're older.
Yeah. And I mean, as you're saying all of this, I wonder how, because you talk about this experience of being younger and the school system kind of saying, saying that you have a learning disability, that there's not much they can do, then your parents decide to homeschool you and really take this into their own hands. And then you go to med school. I mean, that in itself is a pretty incredible story, I think. So how did that happen? I mean, that progression and that confidence, I guess, in working through the learning disability, which I'm sure was challenging.
Yeah, I think my life has kind of been this serial series of lucky events. I end up getting into situations that people can help me through, meeting the right sorts of mentors. Having my mom say, you should be a doctor when you grow up. It's a lot different when you don't really know how to navigate it. Me, like many, first generation immigrant families, Indigenous families, I didn't have any medical professionals on either side. And so even leaning on someone to help me to navigate the way into med school, I mean, it's not a straightforward road. There's lots of twists and turns. I remember the year that I was going to apply and do the MCAT. The real reason why I actually did it was based on a dare. Someone said I couldn't pass it. So I sat down and I studied for, a couple of months doing tests. I was in the later parts of my degree, so I already had, the prerequisites and other things. I had some really amazing mentors who taught me a lot of really amazing things. Ended up passing it, and at that point I then said, well, maybe I should apply for school. But I can't say that I had a lot of confidence at the beginning. And I think it's easy retrospectively to look at your life and go, oh yeah, things worked out, right? But definitely in the moment, it wasn't clear what was going to happen. And as someone in a position where you don't see a lot of those role models around you, I mean, we do a better job at getting people around people now, but if you've never been in medicine, if you don't know someone close to your family that you can ask those questions about, like, what is it like being a doctor? What is it like being a nurse or other allied health professional? I mean, it's a really scary thing to put yourself out there and try and do, and I was scared just like anyone else would have been in my position. I can't say I was especially unique in that way at all.
I love the story about writing the MCAT on a dare. But obviously you did go on to do very well at med school. And I guess I wonder, despite these early challenges, especially in the education system, did you always still plan on going to university?
After I was labeled with a learning disability, we were more or less told, like, you'd never go to university. You'll be lucky to graduate high school. And so it was really reorienting my parents' plans towards what people's expectations were, as far as my capacity, right? And that's not to say that everyone with a learning challenge can overcome it and achieve anything, right? That's not what I'm trying to say. I think there's different reasons why people might have learning challenges, and it's important just to acknowledge like the state of play of how things truly are. But I think for my parents in particular, like they always wanted me to go to university.
You touched on something there that I think is really important. You mentioned the kind of this idea of representation and having role models, people who look like us, who, we can turn to or who we can see ourselves in. And as you were applying to medical school, did you have anyone like that? Like, were there any other Indigenous doctors or any other doctors who had a similar story to yours that were there to help you along the way?
I think there was an awareness that Indigenous physicians were out there, but as far as people who really felt like I could connect with, I wouldn't say so. And I think that's part of the challenge in how you create an environment where people feel like mentors are out there, because sometimes mentors feel very inaccessible. That's one of the things that I've actually brought into the position as president-elect, and one of the things I really hope to do during my presidency over the CMA is, we often elevate the people that we admire or that we're using as, goals for ourselves in order to achieve, when in reality, we're all just people, right? We all go through the same sorts of things. And it's very easy for us sometimes to write other people's stories with a much happier ending and a much smoother transition than usually happens if you sit down and ask them. And so I would say that the mentors were definitely out there, but feeling like they were accessible, that wasn't something that I felt growing up.
Mm-hmm. I'm kind of relating to some of what you're saying here, because I used to work in television, and at a lot of TV stations, there was this push to put more people of color on TV. Mm-hmm. And, the idea behind it, of course, was, oh yeah, diversity, inclusion. But actually what was happening was just, let's hire some people of color and put them on TV so that it looks like we have a diverse workforce here. But making those people feel welcome and making their points of view important in a newsroom, that a lot of that work wasn't happening. So there was that feeling, I mean, for me anyway, of a bit of tokenism where I was there to fill this spot, but I didn't have anyone else. There were no other people of color in one of the newsrooms I worked in. And then I didn't, so, I didn't have that connection or that mentorship, as you're saying. And there were people out there, there were other journalists of color, of course, but I understand what you're saying about not feeling that accessibility and there certainly weren't a lot of them. So it wasn't easy to find those connections. So I imagine it was probably very similar for you, and knowing, there are other Indigenous physicians out there, but not having them in your community, for example, or maybe teaching at your school.
No, I think that's a really good point. I mean, a lot of these concepts, they're universal. They stretch across, different fields of endeavor and kind of just being human. I think sometimes when you focus so much on how things look versus how things feel, you miss out on what inclusion really truly is, right? Like the changes that I've seen in equity, diversity, and inclusion that have had the biggest effect on me is when I felt like I was part of something, not as something that's kind of still this other group that people just kind of engage with, on a scheduled basis, or, sitting in a chair that's been reserved for me, but I actually feel like I'm a part of something. And I think those that are against or have reservations about equity, diversity, and inclusion in any field don't understand that. Like they think what it is, you should have what EDI is fighting for is like the same number of people in the same place across all systems. That's not what it is. It's feeling like we're a part of something, and that's nowhere more important than in medicine. I remember when I was preparing for my medical school interviews, and you go around and you ask people who kind of went through, and I was part of a pre-med studying group, and a couple of the people in there had gone into med school, and they're like, well, you really need to figure out the answer to the question, why do you want to be a doctor, right? And I spent a lot of time thinking about that, and the answer I gave at the interview was, there's not a lot of jobs out there where you can meet someone from another part of the world who doesn't even speak the same language as you, and just because you have the label of a doctor, they start telling you about their bowel movements. Like very intimate details about who they are. And I will say that's something I have always loved about medicine, is we're this safe place, or we're supposed to be this safe place where you can come and share the most scary, embarrassing, sensitive, intimate details of your life. And you truly feel like the person across from you is supposed to help you get out of it, or manage it, and do it without any judgment, do it without, making any type of projected, ideas about who you are and how you are. Like you're just there to fix your problem, the blood in your urine, or the fact that you have chest pain, or these headaches that just won't seem to go away. And I think that at its core is what I think true medicine is. It's seeing the other person across from you, and I think that's the promise of equity, diversity, and inclusion. It's helping people to see who they really are. And when you truly feel that as a physician, I got to tell you, there's no feeling like it.
I've never heard it explained that way, and I just think that was so perfect. I'm gonna have to use that. I mean, the way you described inclusion, and also the way you described the passion for being a physician. I mean, that was great. Thank you for sharing that. That was really powerful, the way you explained it. So I obviously from that, I think anyone who's listening and watching right now can tell you're very passionate about equity in particular in medicine. There was a point for you, this turning point, where you considered dropping out of medical school. Mm-hmm. So tell me about that.
Yeah, so the University of Saskatchewan, which is where I got accepted for medical school, I ended up doing my anesthesia residency there as well. I mean, it's a great school. It's filled with great people. It had a Indigenous entry program that had been around for quite a while, but for whatever reason, there were no Indigenous students in the whole school at the time that I applied and got it in my first year. And I remember coming in and just feeling really alone. I was leaving my family Saskatoon to Regina, it's only a 2-hour drive, hour and a half if you're speeding. But it wasn't that far away, but I felt really, really alone. I lived with my parents when I went to University of Regina for my science degree, and I'm now in Saskatoon, living by myself for the first time, going to school, having people with very, very different experiences than me, and kind of being this oddity inside the class where, people are genuinely interested, but it's the kind of interest that makes you a bit uncomfortable, I didn't want to stand out during the first year. I just wanted to melt into the background. But I mean, I really stuck out because I was the only, Indigenous student at the school at the time. And I remember this one test that we had. And as someone getting into med school, and in the class itself, I mean, you have a bunch of type A personalities that tend to be high academic performers, right? And although I got in with the Indigenous stream, now being in admissions, I would have been a competitive student just by myself, right? But I never would have actually applied if not for the Indigenous stream, just because of the way that I saw myself at the time, and that I didn't have people reassuring me who were in the field that I'd make a good doctor, although I had lots of supportive mentors. So we had this test, and I ended up getting like a B+. And I'm, of course, sitting here catastrophizing, how can I, as, a future doctor, get a B+, so embarrassed and other things. And I went to the professor of the class, and I asked them, could I get some extra tutoring? Because I'm not happy with my mark, and I kind of want to know different ways to study and other things. And the professor didn't actually look up for their table. They just said, if you repeat first year, it's not the end of the world. And then motioned me to leave. And I remember walking out of there thinking to myself, why am I even here? And I was getting teary. I mean, I was a kid, right? Like my whole world felt like it was falling apart, right? And I'm walking down the hallway, and Valerie Arnaud-Pelchet, who is the person who runs the Indigenous entrance program over at the College of Medicine, sees me, and she calls me over, and she knows immediately that something's wrong, you know, and she asks me, like, what happened? And so I told her the story, and even in that moment, I wasn't really blaming the professor. I mean, I was part of, a boy band for years before getting into medicine. Like, we performed for, 20 years, touring around and doing, like, music and, other things. So I learned from a young age that people are going through stuff that you don't know about. And so the last thing you want to do is project onto them how they're feeling, because there's no point. Like, that you're not going to get what you want if you treat people that way. And so I'm sitting there, things are going through my mind why they'd act this way. And the thing I kept on coming back to is, well, it must just be me. Like, I must just not belong here, and I had a really good heart-to-heart talk with Val, and she was insightful enough to realize how alone I felt. And she knew that because she was Indigenous as well. And she actually introduced me to the Dean of Medicine, Bill Alberta. And I actually started going to coffee with him like every other week. I used to just drop into his office, and he'd just drop whatever he was doing and just chat with me for 15, 20 minutes. And he never intervened with anything. But he gave me the feeling that I mattered, right? Like, what medical student can go into the dean's office and just chat, like just have a regular chat? And he's actually interested in what was going on in my life. And that really carried me through med school. I honestly think if Val had not stopped me, and if I did not have those conversations with Val and Dr. Alberta, I wouldn't have finished med school, And it would have taken my life on a completely different path. And I think sometimes we look at people who off-ramp into other fields. They were supposed to finish this. They were supposed to finish that. And we think to ourselves, well, that would have been a waste. I'll tell you, if I went into something else, I think I would have been successful in different ways, but I would not have been successful in the way that I am now. And I think that's the thing that really drives me when it comes to mentorship. I talked about just accessibility for people to know that you're like a real person. Like, you can call me. I mean, I sit down and I chat with physicians who aren't in leadership positions, just people who reach out. I try and do, 3 or 4 Zoom meetings a week just with, your average physician, because it's important to me for people to feel connected. Because I remember what it was like to feel just completely walled off. And Val and Dr. Alberta, they brought me back in. Like, I by the end of those 4 years, I felt like I mattered and I was a part of that College of Medicine. And that's propelled me through residency and the challenges that I had. I've gone back to the feelings that I went through during that whole event when I had low times in my own clinical practice, being off in a rural regional center. Sometimes you're really by yourself. You have support from your colleagues, and I have a great department that I work with, but a lot of times it's just me in the hospital. There's no resident, there's no fellow, there's no other anesthesiologist, and you have that crisis that's in front of you. You got to figure it out, and I have to say that experience for me was the beginning of me stopping the questioning of my own self-worth, that I mattered, because I mattered to the two of them, Yeah.
It's amazing what a difference people believing in you, as you say, can make, and especially when you're not feeling like you believe in yourself and feeling out of place and feeling isolated. It's just incredible how much those two people really, help change the course of your life. Was there a moment when, as you started interacting with them and having these conversations, that you knew you were going to push forward, or was it sort of something that happened more gradually over time?
I think it was definitely more gradual. I think sometimes when we look back on our lives and when we write or talk about what we do, we often like create this image that there was a huge storm and lightning and, you know, wind and everything. And then the thing happened and the skies parted and it was sunny skies and all these things. I had a lot of ups and downs in medical school. I struggled to reconcile the things that I didn't know with the things that I really did know. Because, I mean, I went off and did an undergraduate degree in science. It was in organic chemistry. Like, I was working in the lab as you know, a research assistant. I was published. You know, I was training under someone who was like a world expert in their field of endeavor. You know, I felt like I was high achieving, but not a lot of those skills translated to medicine. You know, so everything from the way that we took tests within organic chemistry, it was mainly, you know, these are the rules. How do you figure it out? I mean, that's not how medical school is. You're memorizing lists of things. You're trying to understand, you know, content related to organ systems that you may have never considered before. And so I'm now sitting there relative to people who took physiology degrees and kinesiology. And, you know, I had one classmate whose like dad was the head of the department of, you know, the field of medicine that they wanted to pursue. And so I constantly was referring back to how I was different. But there was something about those conversations where I did gradually start to realize it didn't matter. Like, those were those people. That was their path. You know, that's what they were about. And I could be about something different, you know. And I think I did match up with a specialty that matches my personality. You know, anesthesiologists, you know, there was a joke that I told a long time ago about, you know, how to explain anesthesia to somebody who's never been under anesthesia. And, you know, if you think of us in kind of the classification of doctors, we're kind of like the medical ninjas, you know, dark and mysterious. No one really knows what you're doing. And we're the last things you see before you lose consciousness. Right. So like, anesthesia is fantastic because you're bringing people into a very stressful situation. You know, at some of the lowest times in their life, you know, people have been diagnosed with cancer, or their, you know, spleen is ruptured, or they've had a broken bone because of a trauma or something like that. And they're sitting there and they're afraid. You know, you may have people who've never been to the hospital before. And in a fairly short period of time, you have to make them comfortable and they have to trust you, you know, and that trust is not based on a complete knowledge of what can happen. It's based on their connection with you, you know, and their trust in the system. And so that really drew me to that. And then the in-between of anesthesia, like, there's so many different ways that you can do an anesthetic well, you know, that flexibility and, you know, that freedom from, you know, specific ways of doing things, you know, was something that really fed over from my organic chemistry education. You know, like, it was more about using general principles to achieve an outcome versus having this rote, you know, directed way of how you're supposed to do things. And so I think for anesthesia, I really fell into the type of specialty that matched the kind of person that I was, you know, my personality and other things. But in med school, I mean, I didn't even know what an anesthesiologist was in first year medicine. And so getting to that point, it took a lot of time. Like I said earlier on, I've been very lucky to have the right people come into my life at the right time. You know.
So how did you discover anesthesiology? Like, was it during residency or?
Yeah, so.
Or not residency, sorry. There's the term before, right? Where you try a bunch of different areas. I'm not describing this properly, but you know what I mean. You know,
you're mostly right. You know, you have, you know, a lot of book learning, and this has obviously changed a bit since I was in med school, you know, all the way back in 2002. But you have a bunch of book learning, and then you have some clinical exposure, and then you start to have some rotations where you know, just dedicate your time to that one thing. Everything was new to me, right? So I was thinking about a lot of different things. I ended up doing a couple summers of research with, you know, a well-respected neurosurgeon in Regina, you know, Krishna Kumar. He's passed now, but he was amazing. Like, he had the longest running research project on spinal cord stimulation at the time. And that's kind of what and he used to call me in at 2 a.m. to, like, put together PowerPoint presentations and stuff. It was it was a blast working for him. He fed me lots of radishes for whatever reason, but he was he was really, really great to work with. And
Amazing.
And as a result, I mean, I was drawn to neurosurgery. And I thought for a very long time, you know, I'm going to be a neurosurgeon and I'm going to be like Dr. Kumar. And I ended up meeting my now wife, you know, in third year. And he ended up having a conversation with me because he'd seen that some of my focus had disappeared. And I mean, obviously, when you're in a relationship, you start to reevaluate what's important in your life, right? And he sat down with me one day and he said, you know, you seem like you really like her. And I said, yeah, Dr. Kumar, I think she's pretty amazing. I think this could really go somewhere. And, you know, I want to see where it goes. And he asked the question, do you think you'd get married if, and obviously it's not up to me, right? But he asked me, would you want to pursue like a really serious relationship, like get married and have a family? And I said, you know, I think I would. I think I would. And he leaned in, and he was never an emotional person. He was very business. He was warm, but he was very business, right? And he put his hand on my shoulder and he said, don't sacrifice your life on the altar of medicine. And then we went back to eating, and I walked out of there, and Dr. Kumar, he didn't talk in riddles, but he wouldn't like unpack things. He'd like give you something to think about, and then he'd like go off and think about it. And I thought to myself, wow, I never really considered like what the specialty would do to my life, you know? And I started to think more and more about what that life would be like. And I had lots of conversations with Wynn about it. And I decided, hey, I'm not going to be a neurosurgeon. I don't think that we're going to end up working out if that happens, you know. To be blunt, there was a moment where she actually said, if you become a surgeon, I think we're done. So I was looking around for, you know, another life path. Ended up having a good friend who was an anesthesiologist. He does intensive care in Red Deer, I think now. And he was in his last year of the anesthesia residency. He invited me to shadow him for the night. And I was told the same trope that most medical students are. Anesthesia is, you know, 95% boredom and 5% sheer terror. So I was kind of prepping myself for, you know, maybe not too exciting of a call night. And it was the middle of the night. We got called to a code, and we walked into this room, and it was chaos, right? Bodily fluids everywhere. The IV had come out. You know, junior people trying to manage it because it was a teaching hospital, right? So the first people to get there are always, you know, junior residents and other things. And we were going through a nurse shortage at the time, so there were junior nurses there as well. And, you know, he walked in, and it was like chaos turned to calm. You know, moved to the top of the bed, started putting in lines, put in the breathing tube. You know, we resuscitated the patient. They ended up surviving. And I remember going home that night, and I'm like, I want to be that. I want to walk into a room that's chaotic, and I want to be able to be that steadying hand that helps people make it through. And I would say to a great degree, anesthesia has given me that. You know, knowing how to not necessarily fix all problems, but fix the problems that overwhelm people. I think it's something I didn't even know I wanted until, you know, my friend ended up taking me around that night, and it's been an amazing journey since.
It's amazing how something so, you know, this unexpected specialty kind of ended up being the perfect fit. And even in the brief amount of time I have known you here, I feel like you do have this very calming presence, and you're exactly the kind of person who someone would want to be there in that moment of chaos or not knowing what's happening. And I think that it's interesting to hear this other turning point of this piece of advice from your mentor, this night with your friend, that really changed everything. And as you pursued, along with pursuing your passion for anesthesiology, you've also really focused in your career in addressing inequity in healthcare, which I know we've touched on a little bit. But as part of that, you founded something called Safespaces Network. So can you tell us more about that and how it came to be?
Well, you probably know most of the things I get involved in are either because of the right people or I have a story. So, the origin of the network really arose out of two things. The first was I was participating at the time with something called the Indigenous Health Alliance. It was a health transformation initiative that was launched originally out of 3 First Nations in southeastern Saskatchewan, Key, Cody, and Kisakous First Nation, and ended up growing into this group of First Nations that numbered more than 150 across Northern Ontario with the Anishinaabe Nation, Northern Manitoba with Manitoba, Keewatin, and Okanagan, and then the Federation of Sovereign Indigenous Nations in Saskatchewan. And, we were really focused on how could we improve the health outcomes of patients, and we got really focused on things like quality improvement, patient safety, and patient-centered care, which before the Alliance actually didn't exist within Indigenous health systems. There was no set programs, although they were ideas that people talked about, of course. And over that time, one of the things that I realized was that there were so many stories that were out there that just weren't being shared. And they were really for two reasons. The first was people were afraid to share them because in the sharing, there was risk, right? So you'd share a story about a bad encounter with the health provider, and as a result, that health provider would find out about it, and then you'd have, a spiraling down of care, right? They wouldn't trust you, they'd be hostile, you wouldn't get different options, they'd shuffle you off to someone else, they'd avoid you, they just make everything worse. The other part of it was people just didn't feel like things changed as a result of sharing the story. And so you had this downside part of risk, and then you also had no follow through. And so I'd been sitting back thinking about, well, how can this actually be fixed, and how can we build this into the strategy? And my brother ended up having an experience where he had abdominal pain, and we talked about this before, and I have his permission to share this story, but he went to the emergency room, got assessed, and then called me. And he called me at 2 a.m., which is weird for my brother because he never really does that. And then he started off by saying, I need some medical advice, which he never does. So I, of course, was excited because my brother's finally asking his physician brother for, some advice on how to do something. So I'm all awake at this point, and I'm like ready to hear from him. And he starts to describe his symptoms, and there's certain things in medicine that everyone kind of knows, right? Like people know how to deliver a baby, people know how to set a bone, and the telltale signs of appendicitis. And so he went through talking about the symptoms that he had, and I'm sitting there thinking, well, this is what he has. And he told me they diagnosed me with something else. And I began to think about, well, why did they do that? What would be the reasons that they did that? And so I started asking him, regular questions to like a physician. What questions did they ask? What was the physical exam? What lab work did they send off? Did they send you off for imaging? What were the results? All these things, right? And it ended up that he had not actually been sent off for anything when it came to labs and investigations. And it didn't actually sound like there was much of a physical exam. And so I'm talking with him, and I'm, of course, worried about him because I know the place that this could lead, right? Like this could be life-threatening. And he said something that was really interesting. So he's a dentist by training. He had owned, several offices at the time, was somebody who contributed a lot to the community, was involved in community events like business leader, all these things. And he said to me, isn't the doctor going to get mad if I ask for another opinion? So I sat there and I thought, I'm having all these experiences in the Alliance about people who are objectively disempowered, people who don't have, the layers of armor that we as, persons of color put on us, our titles, our degrees, our contributions to the community, the people that we know, etc. And we think that armor is going to protect us when we, walk into medical encounters that don't go the way that we want. And here's my brother now telling me that armor is useless, And I talked with him at length. He ended up creating a strategy with me on how he went about, getting a second opinion. Ended up he had exactly what I thought. Went off for surgery later that night. And he phoned me in the morning and he said, I never realized this until now, but when I put on that hospital gown, I'm just another Indian to them. And I think that when you tell that story, I mean, your heart obviously sinks, right? Like how can what you are just completely be stripped away? But that's the culture of medicine for some people. That's the culture of medicine for a lot of people that we're realizing now. And that really was the trigger to start getting into, creating the network. My brother had gotten into, programming at that time and done a lot of stuff with blockchain. And we started talking through how could we create a different way of people interacting where you can let people know what's going on without all the downsides, from the side of, the patient, which is the risk and, the feeling that nothing's going to happen and nothing seems like it's happening. But then also the downside of the person who may not be even aware of like this ocean of culture that they're swimming in, It's common for people to be very upset with these situations, and they're right. This shouldn't happen. We're in 2022. Like this should not be something that we're even discussing right now. We've made enough advances in education and technology where we have the support at our fingertips to do a good job. But in the same sense, if you have someone coming in doing fly-in service for, a remote community, if you get rid of them, there's just no service. So we can't just get rid of everyone who's been hostile to patients because I don't think we'd have anyone working. Like, we can't just eliminate people. We have to find a way to have them plug in. And I think the earlier discussion that we had about me feeling like I was a part of, the college, I think is really what we're hoping to create within the network. How can you have people know what's going on without it being linked to what they are? And how do you help people move beyond this idea that they're not causing harm and tying in their identity as a physician as somebody who only does good, right? To starting to realize that their thoughtlessness or just their normalized behavior that truly is abnormal when you think about it, that accepted behavior is causing harm, but that doesn't mean that you're always a bad person. You're just someone who made mistakes, someone who made bad decisions. And how do you become something different, right? I think transforming cultures in a lot of ways always comes back to how can you become something different? How can you think about things in a different way? And I think that it's really what the network is about. And the fact that we kind of framed it as a learning system, I think really draws to the core of what we're hoping to accomplish is how can we take people where they were and the person that they were, put them through a fairly painful process where they realize, hey, I'm actually causing a lot of harm. Maybe my ideas about myself and the stuff that I do at work isn't entirely true, but then get them to that other point where they realize, the stresses that you had at work, those hostile situations, you actually can fix those if you just treat people differently, and you'll actually like that better than the way that you've been acting, So it's been a pretty amazing journey so far. We're working with the Indigenous Primary Healthcare Council right now with, 6 of their sites in Ontario. We had a project that ran for about a year with the BC Friendship Centers and their 19 sites out there at around the same time as, the In Plain Sight report that came out from the BC government. We're continuing to learn more and more. And at the core of everything is, like, how do you see people as people, to tell you the truth? Like, how do you cut through what we think is there to, the person that's underneath?
Yeah, wow, that's such impactful and such important work. And I imagine it is hard, especially, as you're trying to educate people and forcing them to confront their own biases. It's obviously not easy for anyone to do, but it's also so important. And you and your brother obviously firsthand knowing what those experiences feel like being in the healthcare system. That's just incredible. So I look forward to continuing to follow along with that. And as we were talking about all of these things, I mean, you're incredibly busy because you also are at the moment the president-elect of the Canadian Medical Association. And from my understanding, that's a one-year term, and then you'll be the president starting in August. Is that right?
That's right. That's right.
Yes. And so what has that been like? I mean, especially during a pandemic.
Mm-hmm. So I think one of the things that I've realized that I didn't realize until this year is I think I've unconsciously tried not to tether myself to any organization, because I really like being able to move between spaces and, for lack of a better way of explaining it, being able to do whatever I want,
Yes, I feel that.
Yeah. And so I think with the Canadian Medical Association position, it wasn't something I actually aspired to over a long period of time. Shortly before, the election call was about to close, I had a really close friend who said, you should think about this. This is the impact that you could have. And I looked around to the colleagues that were going through, the pandemic and how it's magnified everything that existed before. Like burnout was not non-existent before the pandemic. It's obviously increased in, its intensity and kind of its permanence across, the medical system. But a lot of these problems, like they're not new. And I sat there and thought to myself, what I'm doing right now, is that going to have the impact that I want? And could I bring something to the position that could help the people around me that I care about? Like I'd been involved in medical leadership with the Alberta Medical Association for years. I had done some stuff with the CMA before, but never formal leadership. I'd done some stuff with the Royal College of Physicians and Surgeons, some things with the Association of Federated Medical Colleges, the College of Family Physicians. Like I'd been around with a lot of the work that I'd done, and I knew these people, and I knew they were good people who were struggling. And I think getting into the election reminded me a lot of actually applying to med school. It was something that you didn't think that you could really successfully get, but you knew it was something that could have an impact. And so I was really honored that Alberta Physicians chose me as their nominee to get into the position of president-elect and then president this coming summer.
Yeah, I mean, it seems like almost a perfect trajectory too, because of all of the other experiences you've had. Now you're able to bring that to this organization and almost have this broad influence, and to bring your experiences and your lens to kind of seeing the big picture and having that influence. It seems like perfect timing for it, given everything else that you've experienced.
Yeah, I think one thing that we commonly say in showbiz is everything makes sense looking backwards. So although it feels very chaotic getting to the end, I can see how a lot of opportunities have lined up to give me what I needed at the time. And I think the role with the Canadian Medical Association is something that not only is interesting, but I think can also be very impactful. But like everything that I've ever been a part of, it really depends on how much we can engage physicians across the country, how much we can get patients into this conversation. It's been great during COVID because people have all become armchair epidemiologists, right? I would love over the next 2 years for people to become armchair health system experts, where they start to understand and speak the language of health human resources. And health is tough because people know that they need it when they need it, but you tend not to think about it otherwise, and there are a lot of challenges we're going through right now. I think they're solvable, but if we don't start trying to solve them, we may not have the same type of health system that we've had as an expectation in years coming forward. And I think that transition point is going to happen sooner than people think if we don't start to act now.
As you're kind of going through this, and I know you mentioned there looking back and obviously seeing things differently once you're able to have that now experience and look back at what happened before. I wonder, as you kind of reflect back on your turning point in medical school and these mentors, these two people who really changed the course of your life and encouraged you to continue pursuing your medical degree, what do you hope that others might learn from your journey?
Mm-hmm. That's a really good question. And I think my answer now is a lot different than it was when I was going through it, right? I think when I was going through it, I mean, I had the common tropes of, you can overcome adversity if you try hard, and, you can mentor someone through any challenge and things like that. I'd say after many years of reflection and seeing how it's changed who I am as a person, I think what I'd actually say to people now is the challenges you go through and the people that you meet make you into the person that you're supposed to be. If you're someone trying to get into medical school and then you become a nurse, it's okay. Like you're still in a place that you can have influence. You can still make an impact where you're currently standing. And there's not really better or worse when it comes to being a doctor or other healthcare provider or a patient or anything. Like we all just are who we are, right? And the second part of that is to embrace what you can do right now. I think we often wait for that moment far out in the future where once I have this title, once I have this degree, once I have, this relationship, once I have this money or this grant or this funding or whatever, I'm going to change everything. The truth is you could make your dent in the universe right now, and I think that empowerment is something that we really need, physicians in the country to realize. You have so much power already, but we also have to create systems where our providers can feel that way and our patients can feel that way as well. It's in that empowerment, like that shift in thinking where you stop waiting for change to happen and you just start making it happen, that I think big change occurs.
Yeah. I think the way you explain that, especially the embrace what you can do right now, that's really powerful. And I think that's such good life advice, because you're right. So often we tell ourselves, oh, I'm waiting for the perfect moment, or until I have whatever it is, finish this degree or have this amount of money or finish this program, perfect the skill that I'm trying to achieve. When sometimes you just need to do what you can right now and just get started. So thank you so much for all of the stories you shared today, for sharing your insights. I just really enjoyed this conversation, and I look forward to continuing to follow your career.
Yeah, it was great to be here. Thanks again.
And thank you to all of you for watching and listening today. If you're enjoying the show, please leave us a 5-star review on your favorite podcast app. You can, of course, also follow the show on YouTube, and you can find me on social media at PriyaSam. Until next time, take good care of yourselves and of each other.